Welcome, everyone. Thank you for being here today. As we approach the fourth week of quarantine, we are still feeling fears of uncertainty, overwhelm, and anxiety. The Dela Cruz law firm wants to let our seniors know that we are here to be a resource for you. We want to reduce any anxiety or fear that you may be feeling. As we navigate this crisis together, we are committed to bringing you important and relevant information and any changes in laws and updates to see how our senior communities are doing. Today, Keith, Bridgett, and I are bringing you information on important legal changes that impact your planning. We'll also be providing a resource to you on how to take care of your loved ones if they are diagnosed with COVID, Medicare resources and changes which are available to you. Stay connected with us in the upcoming weeks as we will be providing additional purposeful topics to help you through these trying times. There will be a question and answers period after our presentation. Please raise your hand in the chat box or you can type out your questions. We are also recording this presentation if you want to share it with your friends, family, or network. Please contact us at admin@delacruz-law.com. Additionally, we'll be having everybody's contact information towards the end of this webinar. In this crisis today, there is an importance of healthcare decisions. Many people who are in the hospital right now, doctors are looking towards advanced healthcare directives. Everyone should have an advanced healthcare directive in place. You may ask, what is an advanced healthcare directive? And that is a legal document which guides physicians and other individuals who are taking care of you with end-of-life decisions, also appointing a guardian, so somebody who can speak on your behalf, and somebody who can make those decisions for you if you become incapacitated. Now, I'm not sure if you remember this, but years back, there was the case of Terry Schiavo. There is often guilt associated with becoming an unexpected healthcare agent, in the sense that you want to be able, in this critical situation, to be able to guide your loved ones in how you want to be treated. If you don't have a medical directive, there's essentially no decision maker. There are no directions for your loved ones or for the physicians, nurses, or other individuals who are taking care of you. There could be delays and additional costs. In Georgia, we have something called the Advanced Healthcare Directives. There are 3 parts to the Advanced Healthcare Directive. Part 1 identifies who the decision maker is. So let's just say if you were incapacitated due to COVID-19, you would identify somebody who could make those medical decisions for you in an event that you could not speak for yourself. In some situations, people will pick family members or friends to make those decisions. In guiding those choices, you want to make sure that the person who you choose is somebody that you can trust, that they will follow your decisions, and that they're comfortable in making those decisions. Part 2 also includes end-of-life directives. So how would you want to be treated in the event that you would not be able to recover, or if you were treated with a terminal illness? In certain situations, this is critical because it provides much needed guidance in a time of stress for your loved ones. There are some people who might not necessarily know, or you might not have necessarily communicated those important guidelines. There are some people who want every kind of life-saving measure done for them, or the opposite of that is that they only want to have a natural passing. So it's important to have these conversations with your family members, with the friends, and with the agents who you may choose. In times and situations like this, it's important to have clear statements of your intent of how you want to be treated. to your loved ones. I've been in many situations where this wasn't communicated. And during critical times and decisions have to be made regarding organ donation, or how, or whether or not CPR should be used, or a ventilator in the case of COVID-19. It's important to have these conversations now. And even though they may be uncomfortable, it's important to have them now because you want to prepare your loved ones in the event that something happens to you. Additionally, an advanced health care directive avoids guardianship proceedings. It nominates that this legal directive can nominate somebody to speak on your behalf in court if there is a dispute as to how your end of life should be handled. Now, important in a recent update has been the recent order under the emergency order by Governor Kemp. He allows us now as law firms to prepare these advanced directives and all estate planning documents virtually. And this order was actually issued on April 9th, but all of the estate planning law firms in Atlanta and in Georgia were made aware of this on April 10th. Why this is important is I know that a lot of families and loved ones who might not necessarily have done their planning, their estate planning, or their advanced directives, or their powers of attorney, they're concerned. They're concerned about coming into an office because seniors are part of the vulnerable population. But now law firms like mine have, mine specifically has a contactless procedure. There's no human contact. We would be doing all of the pre-work on calls like Zoom, like we're doing right now that you're watching on the webinar, and we're doing that all virtually. Then we would do all of the remote signings virtually, which means that you wouldn't have to come in contact with anybody that you don't want to come in contact with. The best time to do this is now. Please, please, please do not wait. It's so important for you to do the planning because in the end, if something happens to you, you want to make sure that you're protecting your loved ones now. Thank you. Bridgett, we're going to go ahead and turn to you.
Hi, good afternoon, everyone, and thank you again for joining, and thank you, Cherish. I think this is a great segue into what I have to talk with you about regarding the care options post-hospitalization and the discharge process and how we can help. So Beth Casey is our owner and founder. She's a physical therapist, licensed physical therapist by trade, but she's also a licensed dementia care specialist. And so I'll go into why that will be important in our future slides. But just to know that we do have licensed healthcare providers as part of our leadership team. So that's me to the left. Lori is our VP of Clinical Operations. She oversees all the clinical components of the processes that we do, from the admission, discharge, and oversight of the care that's being provided. Laura Casey is our licensed medical social worker, and she's also a certified geriatric care manager. So she can help any kind of complexity issues that are coming up, family dynamic issues. If someone is in need of a guardian or they're in need of a referral for elder law, that's how we can help come into play there. And then Bear is also our president and chief operating officer. So what we're going to talk about is our hospital to home program. We are actually currently rebranding this program to transitional care because it really is applicable for any setting, whether it be hospital to home or rehab to home, or even moving into an assisted living or a change of level of care in an assisted living. For instance, independent living to assisted living or assisted living to memory care. So collaboration is key. Right now, more than ever, collaboration is really how we're going to get things done without being able to have visitors in the hospital or family at the bedside. It is really important to have someone to act on your behalf. One of the processes that we do with collaboration is we help the family and the professional, and we're kind of in the middle as the liaison. So we're able to have those detailed conversations with the healthcare providers, find out what's going on, and help relay that information to you as the family and put the care plan in place. This provides timely case management and restorative personal care services to you and your team, you and your family. Okay. And we've all seen that, right? Together, everyone achieves more. So the stakeholders in transitional care. So the clinical nurse staff and the physicians, the patient, the family and caregiver, Medicare home health agency, pharmacists, nutritionists, dietary services, and private duty home care providers. The clinical and the nursing staff at the hospital, they're going to be really handling the most acute issues. They're the ones that are going to be taking care of your loved one day in and day out, and they're really just trying to handle what's immediately in front of them. And then you have the patient that is there receiving the care. And the family is often caught in between, trying to figure out what is going on. How can I help my loved one? When are they coming home? What services do I need to provide when they come home? Can I help them with this care when they come home? And now we've added another crisis layer, which is whether they have a positive COVID test or not. And if they do, who is going to be there to provide care in the event there is a positive COVID test? Medicare certified home health companies are a little bit different than the companies than companies like mine, private duty home care providers, meaning they are going to bill Medicare for skilled services that you will receive in the home, which is typically skilled nursing services for wound care management, physical therapy, occupational therapy, speech therapy, whereas we provide assistance with activities of daily living, so things that you need to do day in and day out. So getting up in the morning, getting dressed, breakfast, medication reminders, all of those things that kind of really go into the wellness and preventative side of care. We also have a skilled nursing license, which helps to oversee the non-skilled component. So our nurses go out and develop the care plans and work hand in hand with the caregivers to ensure that they're doing proper procedures. So the role of private duty in delivering high quality care. What we do for our transitional care program is our CaraVita registered nurse meets with the discharge planner. So right now that is taking place by phone. Actually, last week we received a referral from an inpatient rehab community in a local hospital, and we actually have our registered nurse that is meeting with the family today to do a home safety assessment. And she'll relay that information back to the discharge planner at the rehab because they're not able to go out to the home like they were previously. So we're stepping in to help both the rehab services as well as families at this point in time. The home safety assessment is really important because it will help you set things up for success when your loved one is being discharged from the hospital. If they've had a fall, if they've had a fracture, if they've had a stroke, if they've had a change in level of care, knowing when and how to have the patient in the home, where is their room going to be set up, what is the best place for them, and how to provide care is very important. So coordinating with other healthcare providers and DME. We help the discharge planner set up these services with the home health providers. As I mentioned about the difference between the services we provide and the services certified home health providers do, we help set that service up. So we make sure on discharge day, you're getting the services that you need, and we've coordinated that with the providers. DME stands for durable medical equipment, and so that means if your loved one needs a hospital bed, oxygen, bedside commode, any of those items that you're going to need at home to be able to be successful when getting home quickly, we will help set that up. That is all verified and reviewed by the discharge orders. So we make sure we take a look at those orders from the physician, and we can relay those terms to you. If there's something you don't understand in the verbiage and the medical jargon, we will break that down for you and so that it's easy to understand. We also provide all the patient and family education for the discharge orders and what that follow-up will look like. We arrange for the MD and follow-up appointment. That's really important right now because many primary care providers are doing telehealth visits and they're not actually having in-the-office appointments, so we can actually help facilitate that telehealth visit with the client themselves. And then, of course, we train the caregivers to address specific medical diagnosis and health concerns. What I mean by that, we actually take a look at the discharge plan and the diagnosis of your loved one, and our registered nurse does the training one-on-one with the caregiver to your specific needs or your loved one's specific needs. And that's very important as everybody has different needs, right? Some people may have a catheter, some people may have a G-tube, some may just have issues with Parkinson's and need help with transferring from wheelchair to bed or bed to chair. And so we do a one-on-one training with our caregiver and your loved one. So the first day home, We receive the patient at discharge in the home, and so our caregiver is there. If our registered nurse has not already done the home safety assessment, she will also be there at discharge time. We coordinate that delivery and make sure that that DME is there, that durable medical equipment. Hospital beds are really important, right? Because if you're coming home from the hospital and you have a fracture and you are in need of a hospital bed, or you have a diagnosis of COPD or congestive heart failure and the head of your bed needs to be elevated to a certain degree, and you don't have that when you get home, it is challenging to get in and out of a different bed, right? It's just the little things and that attention to detail that really makes a huge difference. So we make sure that that is there, and we coordinated that with the hospital. Cherish, if you could just take over for a moment, and I apologize, I'm not able to see.
Okay. Ensure that foods are available if on a certain diet or proper nutrition, and to review the equipment, and then in general, performing a home safety assessment.
Yes, that home safety assessment is really key, and our owner set that service up with initially because she was overseeing skilled nursing facilities, and so she wanted to make sure that we included a home safety assessment because that was the missing piece with most discharges.
Okay. And ongoing caregiver activity with RN oversight. So some of the things that were listed, and then you can expand on this, Bridgett, but nutritional support and a balanced diet, assistance with transfers and ambulation.
Yes, ma'am, absolutely. So that is very important, that the assistance with transfer and ambulation, as I was mentioning before, because that is the area where most falls happen when someone is transferring from one setting to another, from a bed or a wheelchair, whether they're going from sitting to standing, and especially in the middle of the night, that is a lot of times when the most frequent falls happen. They happen either in the bedroom, getting up to the bathroom, or and sometimes, you know, headed to another room. So making sure that you have someone that is there to help with that during that first 24 to 48 hours is really important, especially post-hospitalization. Monitoring for hydration, ensuring that, especially with dementia, you know, people forget to drink. They forget to have taken enough fluids throughout the day. So that monitoring of hydration is so key in preventing urinary tract infections, preventing skin breakdown, preventing, you know, just everything that goes in with hydration that is so key and essential in the care of someone that is a senior. Maintaining the integrity of the client's skin. So our caregivers will also monitor for skin breakdown and to ensure that that skin integrity is well maintained, whether it be from frequent changing or positioning of the client. And of course, that goes into the end-of-life care that our caregivers will also provide at end of life. Ensure proper hygiene and scheduled bathing and grooming. This is a big challenge with dementia. You know, many times there's a refusal for showers and bathing, so a bed bath or whatever method that the client feels most comfortable with. But hygiene is so important because for more than just reasons of physical appearance, it is actually for a senior, it's imperative that they get proper peri-care and hygiene to prevent that UTI. Every time there is a urinary tract infection and there's that inflammation process that's happening, there can be a trigger that's associated with the brain and the bladder work together, and you often see dementia-like symptoms progress more rapidly with one infection after another. So if you can stay on top of hydration and maintaining good skin integrity and proper hygiene, you can help keep the client as healthy as long as possible. Medication oversight and reminders. This is also key for wellness. Many times people will forget to take their medications, and seniors will forget that it's time to take those medications. And so then you get the impact of hypertension, or their diabetes isn't controlled, or, you know, just any of the medications, thyroid medications. So that medication reminder and oversight is very important. Also ensuring that it's the proper dosage. Many times you go to one doctor and they prescribe a blood pressure medication that is one dosage, and then you go to the hospital for a CHF exacerbation, and you come off on a different dosage, and no one has looked at what you were on previously. So we reconcile those medications. A registered nurse will do that reconciliation. Sleep management. We work with the client on that sleep-wake cycle, especially when we're dealing with dementia. And I know everybody's probably familiar with the words sundowning and the term sundowning and what that actually means. So we work with the client on what rhythm and what schedule works for them and try to get them in a daily routine, because sleep is so important and often one of those things that's mismanaged with our senior population. So not using sleep aids that are habit forming or can alter the mind or increase falls, but more natural approach with talking with the physician. Maybe it's melatonin, maybe it's they were sleeping too much during the day and now they don't want to sleep at night, so keeping them engaged during the day with purposeful activities. And then, of course, with that assistance with toiling, which is also important. This one is key to our listeners because caregiver burnout is huge, right? If you're a home caregiver for your loved one, so we offer, with our licensed medical social worker and geriatric care manager, we offer stress management. We also offer resources to you, support groups. There's now a lot of virtual support groups, Zoom. We've been connected with all of them, so we can help you if you're suffering from this. We also have a resource that we will attach at the end of this and will be posted also on our website, which is a resource for family caregiving. We support the client in therapy from the home health services. So what we tend to do, a lot of times people will think of therapy, physical therapy, and think that that's going to be the key for mom or dad. And therapy is so wonderful. We support that therapist. Again, our owner is a therapist, but one of the keys to successful therapy is executing those therapy exercises at home day in and day out. So the therapist can come into the home and they can put together a home therapy regimen or exercise program. But if the client doesn't have the capacity to do that every day, we will step in as their agent and execute those activities, right? So we will do range of motion exercises, ambulation, walking with the client, help them with those specific exercise programs. So we're not going to make changes to that. We're not going to add a new regimen, but we will execute that. And we've seen that be very successful in our restorative program. So that is key to success with home therapy. Encouraging the exercise routine and positioning. Ensure safety from falls in a fall prevention program. So again, with that home safety evaluation, we go out and look in the client's home, in the client's bathroom. We make suggestions on repositioning furniture, changing the way things are positioned, removing items that could cause a fall. And that ensures safety, and it also helps to reduce the risk of falls from trip hazards. We also instill confidence in the family and loved one that is receiving the care, right? So you are also our client. We not only take care of the senior, but we also want to take care of the family. Provide treatment if dealing with chronic conditions. So we can help manage some of the ongoing treatments with chronic condition management, such as diabetes, and we work with our registered nurse on some of those things. And so they can train the caregiver for a higher level of care, which is called proxy care, and that's where we can do things even that you might.
Did we lose Bridgett?
We might have. Yeah, I think we did.
So Cherish, let me use this time for some of our participants, our attendees that came in. Can I speak for a second?
Yeah, go ahead.
Okay, great. This is Keith Nabb from Affordable Medicare Solutions. One of the main things to take away from today is understanding that a team like ours, Healthcare Transitions Team, is a way that the families know that they're dealing with professionals who know each other. So that when you're transitioning your parent and you're having to have different professionals working with them, it's really helpful that those professionals know each other personally. Those professionals probably have each other's cell phone numbers. If they need to call each other on the weekends or nights, they can do that, so that the family's not having to be the go-between and translating all this between the professionals, but that we all can work as much as possible as a team together. It really removes a lot of stress. It also gives the family confidence and peace of mind that they are dealing with people who vet each other, that hold each other accountable, and make sure that they're fixing problems that do come up. They're not being put on a shelf or in a waiting list, but they're being brought to the front of the line and taken care of as quickly as possible. So it's really important for other professionals who are referring families for our services to understand that they're going to get this team approach, that we are all, even though we're not in a legal partnership with each other, we are in partnership because we have the same goals, is to make sure we reduce anxiety and make sure that obstacles are removed and the process is smoothed out as much as possible for the families and for the patients.
I want to reiterate what you were saying, Keith. I've known Keith for several years. We were on the same Gwinnett Senior Council board, and it gives me peace of mind, and it also gives my clients peace of mind that I have a wonderful team and different colleagues from different expertises to share in all of the collaborative thinking that we are doing. Something that we discussed in the beginning is that we want to make sure that our clients understand, or potential clients understand, that we are here to be a resource for you. And so when I have a Medicare question, the first person I call is Keith. And Keith does have my cell phone number. And, you know, because this is such a fluid situation, we are always looking at different resources and making sure that there's a timely delivery to you as clients or potential clients. And so if we can do anything in any of our respective expert capacities, we are happy to do that. So Keith, let's go ahead and go to your slides while we wait for Bridgett to come back on.
Okay, great. So there's a lot of things going on right now in the Medicare world, and to preface this slide is that my agency, Affordable Medicare Soulations, is in our 25th year, and I have myself and 8 employees. We're wholly different than any other Medicare advisor in Atlanta. We do act as a resource center for all sorts of situations, so that people are calling us to say, hey, Keith, how do I move my parent? How do I do this or that? And we're going to refer them out to our professional network and not just manage their Medicare plans, but that's what we do. And as Medicare changes rules, or as the different circumstances such as this COVID-19 crisis is happening, we are very much on top of all of the new updates that are happening, sometimes on a daily basis. So let's talk about a few of the things that have highlighted, and it might not just be in healthcare, in Medicare, it may also be in healthcare in general. So you can see the first bullet point, it says, today, most companies offer free COVID-19 testing, both in Medicare and in healthcare. And I couch that a little bit because we've heard a couple of small companies out there not playing along. So it is important that you do check with your provider, but in general, most all are providing this testing. Now, you may need to have all the symptoms, and you may need to have a telehealth approval from a doctor ordering that. So don't just run into a testing center, but call your health plan and ask them how to access that testing if you do qualify. The second bullet point is that there are new things that happen, such as special enrollment periods. Usually we have a published list of those, but sometimes if a hurricane or a virus outbreak or something else happens, we're given limited special enrollment periods where we can help people who are being affected by that natural disaster. And so every year when we have a hurricane, certain areas will have that issue happen, and then it'll be a certain time frame that we can use that. Now, we can either enroll people in new plans, or we can fix their existing Medicare plans. So it's not a perfect situation, but it is a creative way that we can apply some rules and massage the situation in somebody's favor. If we look at the third bullet point, you see that now telehealth. In Medicare, there was no such thing as telehealth 3 years ago. 2 years ago, they tested telehealth in rural areas, and it worked pretty well. And they said, this doesn't make sense. It takes somebody an hour in Atlanta to get to a doctor. Why don't we just make it for everybody? So they expanded it. And that was perfect timing for this COVID situation. And they are expanding even more telehealth. I have colleagues that do mental health, and they are doing all of their mental health visits by telehealth, and they've gotten a huge surge on that. Well, most of healthcare now, if they didn't have the telehealth services, they have contracted out as quickly as possible to get that going, because it is the dominant way to access medical care right now outside of a hospital circumstance. So that's very important. Check with your carrier to understand what numbers to call and how to access that, hopefully, with no extra charges. Now, on prescription medications, there was a rule, legislative rule. The governor also signed in on this about 90-day refills on most medications. Some, they are still not going to do that for dangerous medications, but for most, they're going to give you a 90-day refill, and that is important so that you're not in a grocery store, in a pharmacy, unnecessarily exposing yourself. Another thing that's really, really important is that there's also now critical relief aid that's been given to insurers and also healthcare providers like hospitals to pre-fund their extra needs in these prepayments. So they've been distributing billions of dollars of cash, and that is giving some relief. I've heard from some carriers like United Healthcare that they've issued out up to $2 billion of prepayments to help out so that there aren't any cash crunches. And that is really important. We don't want to find out a month from now that people are being denied care when it could have already been prepaid. So this is happening right now. Some interesting things that have happened that aren't really truly official at the healthcare.gov, which is health insurance for the Affordable Care Act. We have been hearing that they have been not requiring so many bureaucratic proof of loss of insurance or other proof. They've really relaxed it and are being a lot more generous in letting us get the health plans issued so that if somebody is uninsured. Now, they are lobbying to say, hey, if somebody doesn't have health insurance, we ought to open the Affordable Care Act up, and that has not yet happened, but it could at any moment. So we're waiting to hear if that's going to happen. But if somebody loses other health insurance, like group health insurance, an employer plan, then we can get them an Affordable Care Act plan on the 1st of the next month. That's really important. Now, if a person is moving, on the next bullet point, if they're moving from one assisted living facility to another, or they are losing their employer-based health plan and they are in Medicare, they are going to also have special enrollment rights in Medicare, and we're going to use those all the time. And that's even outside of this COVID crisis. I use those special enrollment rights to fix people in transition between care centers or leaving work back into and going into Medicare. That's important, but even the most important thing here in all of this is that the end-of-year review appointments, where people can review their Medicare, are now more important than ever. You need to make sure that your provider is covered. You need to make sure that your hospital's covered, that your drugs are covered, and that you're not missing out on extra benefits that you're eligible for. And you can do that from October 15th to December 7th. And we can make changes, and they'll always be effective on January 1st. There are other times to make changes, including January, February, and March for certain people under Medicare. They just need to call my office and I can tell them what they're eligible for. But everybody in Medicare has October 15th to December 7th. It is the annual open enrollment period, and it is more important than ever this year, because if you're casual about this, you can have an ugly surprise in January that your important drug or your therapist or your doctor is not covered in January, and you don't want that to happen. So these are all important things under Medicare. We've done other talks on much more detailed circumstances, and in the future, Cherish is going to highlight some more topics we're going to go over. So if you have questions, you can obviously email me, and our information will be at the end of this presentation. Thank you, Cherish. Your turn.
I think we've got Bridgett back on with us. Bridgett, are you on?
Hi, I am. Can you hear me?
Yes.
So I apologize. I wanted to pick up where we left off about the private duty caregivers and how we can improve patient care and outcomes, because this is really important. As we have worked with hospitals, ongoingly, we've been monitoring readmission rates. And right now with COVID, the last thing that people want to do is to end up back in the hospital. So some of the things that we've been able to do is monitoring for changes of condition, even subtle changes, lack of appetite, lack of wanting to take in enough fluid, making sure that the blood pressures, weight, and blood sugars stay within the certain parameters that have been assigned by the physician, and we report any of those changes to the primary care doctor. And what that will do is that will help capture those changes in condition before they lead to something requiring a hospitalization. Of course, sleep and exercise and behavior changes as well. We develop a behavior support plan for dementia residents or dementia clients, whatever their setting might be. with the family, the community staff, if they're in an assisted living community, and our team to help reduce those behavior expressions that you might see with someone with a dementia like Lewy bodies, or something that may have some changes in those, that may be a little bit more, aggressive in tendencies. So what we try to do is, rather than the use of psychotropic medication management, which is oftentimes the first line of treatment that people go to, we like to do a behavior support plan where we find out a little bit about the client, where we find out, what are their likes and dislikes? Who were they, right? Who were they when they were younger? And what did they do for their occupation? What types of things were they interested in? And try to engage them. And once that engagement happens, we often see a reduction in those behavior changes, which often leads to a reduction in sending a patient out to an emergency room for behavior expression. So, client-centered care, of course, everything is client-centered, and that goes into everything that we've talked about. And I know that I don't want to waste time going over the same slide over again, but if you have any questions about that, feel free to let me know. All right, the nursing oversight. So how does this go? Our RN checks in with the certified nursing assistants. They're all CNAs, and we also have a CNA school at our office where we train our own CNAs and to make sure that they are trained appropriately with hands-on skills checkoff. And we check in with them regularly to see how things are going. They are managed by a case manager that takes care of the client on their caseload each and every day. They are touching base with the CNA, making sure that there have been no changes in condition. If there is a change in condition, the registered nurse reports that change in condition directly to the physician. They also keep the family informed of that change in condition if that warrants a medication change, or if we need to start doing something that we weren't doing before. So maybe it is now we need to be monitoring their blood pressure every shift, and we will start that depending on what the change in condition is. And the last document that we have is the resource for families and family caregiving. I don't know if you're able to pull that up or if you wanted to. If not, we will be posting that resource on our website as well at CaraVita.com.
Okay, great. And then can you just describe a little bit about that healthcare resource guide that you have, and what its details with respect to the COVID-19 procedures?
Absolutely. So we've been doing a lot of education about the way that the way that COVID-19 is spread. So COVID-19 is considered droplet precautions. There's a lot of information about aerosols and how things are spread in the air, but in a typical setting where you're not doing a procedure that creates an aerosol, COVID-19 is spread by droplets, which means if I cough or sneeze into the air, up to 6 feet, my droplets can travel, and then they can land on a surface. Well, when they land on that surface and I touch that surface and I touch my mouth, nose, face, then I can become contaminated with those droplets. At the same time, if you do the same, we can be exchanging that virus back and forth. So if we wear a mask, my mask protects you, your mask protects me. In a home caregiving setting, both parties need to be wearing a mask. That's why it's important that the mask for all movement, but that applies in the home setting as well. You also want to avoid doing any procedures in a room with someone that may create an aerosol. What you might see in a home-like setting that could create an aerosol are nebulizer treatments, right? You're going to wear an aerosol mask, or you're going to have the tube. When that goes into your lungs, it can create an aerosol, and then those particles are small, and they can travel into the air, and they can stay there for extended lengths of time. Also, that's when the specialized N95 mask would be warranted versus a surgical mask or a handmade mask. Handmaids and surgical masks are appropriate for the droplets, like I was talking about, where we cough, sneeze, talk, where they travel 6 feet, fall to a surface. If we're conducting an aerosol generating procedure, like a nebulizer, CPAP is also something that we typically will do in a home setting that can generate an aerosol. Then we need to be wearing an N95 if we're going to be in the room with someone. If you're not going to be in that room with them, if you're going to set up the equipment and they're going to be able to do that themselves, staying out of that room for about 3 hours at least post-treatment is important, unless you have donned an N95 mask. They are challenging to put your hands on nowadays because they're in short supply. So that's why we do want to let people know about the risk in the home environment. Also, anytime you're providing close personal care to someone, bathing, dressing, transferring them from chair to or from bed to wheelchair or to a standing position, you're going to be in close proximity to that person. And so it is important that you're both wearing masks for personal care. We do recommend that the caregiver also wear something protective on their clothing, or if they don't have like a protective gown, wear a shirt or something that they can just remove right after taking care of the person and wash that, as well as gloves and proper hand hygiene. Wearing gloves is protective as long as the gloves are not touching other surfaces once they're contaminated, because you will spread those droplets other places if you have contaminated gloves. But if you are very careful with wearing gloves, it is the best practice to wear obviously for personal care reasons. Hand washing is key, both before and after applying those gloves as well. So you want to make sure you wash for at least 20 seconds, because again, that's where you pick up the virus, right? You pick up the virus, if you're not doing an aerosol procedure, you pick up the virus from a surface and then you touch your face. And we know how hard it is to not touch our face. We do it all the time without even thinking. That's one benefit of wearing the mask, is that the mask, as long as we're not continuing to touch the mask, it does train us to not touch our face as frequently as we usually would. So those are some really great caregiving tips to help prevent, because then many times once it's in the home with one family member, it's going to spread to other family members. We want to isolate that family member, quarantine them, if you will, to one room or one area, and then have one dedicated care partner that can enter and leave the room and do all the best practices with hygiene following that. One key takeaway for laundry: you don't want to shake the laundry, because as we talk about, it's spreading into the environment. You don't want to shake out bed linens. You don't want to shake out towels. You don't want to shake anything that has come in contact with that person. You want to close it up tightly, hold it away from your body, carry it, put it directly into the laundry on the hot water. You don't want to make sure you're not shaking any of those droplets anywhere, any of the viral particles. That's also on that key resource list that we'll have available.
Right. Okay. And so all of the attendees, and then for people who are on the recording, will also get a copy of that as part of the recording. I thank you, Bridgett. I think that's very helpful. I mean, I think from what I'm hearing from my community and my network is, what do you do after something like this happens and you do have somebody who is at home? But, the resources that you are giving us and the tips in terms of, what are practical solutions that we can use to take care of our loved ones is quite helpful. Any last minute tips or recommendations?
I saw on a video clip, it was an ER physician that was using a great analogy, and he said, think of the virus as being glitter, right? And how hard and obnoxious it is to get glitter off of everything. So, you want to keep glitter from spreading on things. If you had an open container of glitter and it was on something, you would want to keep it from getting all over the place. That's how you want to handle anything that comes in contact with the person you're caring for that has COVID. You don't want to mix dishes together. You don't want to put them in the sink together. You want to put it directly into the dishwasher. Use disposable if possible. I know that can be a challenge right now, but any way that you can prevent their belongings and things they are using from coming in contact with things you may use, and wash your hands in between every single thing that you touch or do when caring for that person.
Thank you so much, Bridgett and Keith. And we are going to wrap up right now, unless there's some questions. I know I like one thing that I did want to highlight, Bridgett, was how your institution and how, the theme of being proactive in this situation is key. Proactive in the sense of what can we do to prepare if the COVID does impact our families, but then also, as we transition out of this quarantine and as we get back to, you know, what life was like beforehand, we want to be able to make sure that, you know, Keith, Bridgett, and I are giving resources to you, because there will be, I mean, I know it doesn't feel like it right now, but there will be a period of transition. And so in going with that theme, we are going to be talking about how to transition from what it is now. And, you know, we put this healthcare transition team together. And so topics that we will be discussing in the future are things like updating your wills, you know, having a financial power of attorney in place, and Bridgett, you know, as we discover more antibody testing, and then what as a caregiver you can do to protect yourself. And Keith will be discussing topics like, you know, unfortunately, employers are having to let people go. So, you know, what do you do so that you become eligible for Medicare coverage, you know, Social Security, disability, and Medicare in general. We just want to highlight the fact that we want to be resources for you. This slide deck shows, you know, our contact information. This is Keith's contact information, and then Bridgett's. But all of the attendees who are here will be provided with some key documents that that will help you and your loved ones if you are impacted, and then other additional resources. But please, please, please feel free to reach out to us. We know that people are stressed. We know that this is a time of uncertainty, and we just want to be a resource for you. We truly care about your well-being, and anything that we can do to help you during this very stressful time, we want to make sure that we are able to do that. Any last comments, Bridgett or Keith?
I think people should just call. They shouldn't assume. They should just call and ask questions.
Yes, thank
That's
you.
right.
Thank you, Bridgett. Thank you, Keith.
Thank
and
you.
We will be having weekly seminars addressing these topics, and they will be on Mondays around the same time. I think this would be a good resource for other people. Thank you, everyone. I appreciate it.
Thank you.
Thank you, everyone.